Hey guys, it's Dr. Justin Marchegiani here. Hope everyone is doing phenomenal. We're checking in on this Christmas Eve edition. Really happy to be here. So let's dive in. I got some questions here already. If you guys have any questions, feel free and punch them into the chat box there. Awesome. All right, so a couple things off the bat. Anonymous writes in, I have a leaky gut. I developed arthritis. I cut grains and dairy and sugar out, but I still have GI problems, joint pains, and I have to do joint pain. What I have to do now, I'm diabetic, still eat meat sometime. Okay. So in general, we got to look deeper. We got to go through the full 6R protocol. This is a typical symptom, a typical issue of patients that come and see me where they've made some good diet changes. And they're like, hey, I'm really not seeing that much results. Right. And then the question is, well, what's the next step? Well, the fact that this person is diabetic tells me that their insulin and their carbohydrate and their macronutrients are not dialed in. And more than likely, they've only made the first change in the first out of 6 hours, right? The first hour is removing the bad foods. Great, you did that. But it doesn't sound like you've dialed in your macronutrients yet, because you can still eat relatively, paleo template, but really have the carbs and proteins and fats out of whack. And it sounds like that's the case with you. If you're still having this insulin resistance, we need to do the next 5 hours, which is remove the bad foods, which you did. Maybe not the carbs, though. The second hour is replacing enzymes and acids and bile salts. Got to make sure your stool's digested fully. When we look at repairing the gut lining and we look at supporting and repairing the hormones, fourth hour is you work on removing the infections. Fifth hour is repopulating, reinoculating good gut bacteria. 6 hours retest to make sure we got it all. Hope that helps. Kay Gupta writes in, I get constipated after eating a high-fat diet, especially goat cheese. Can you please recommend a good supplement for bowel movement? So number one, there could be an issue with just you having a hard time tolerating the casein protein in the dairy. It could be a dairy issue. How do you do with other types of proteins, steak or fish or beef? If it's just unique to goat cheese, that tells me there's a casein issue. But of course, we can increase enzymes and acids and bile salts. And I want to make sure your stools are sinking, not floating. If they're floating, right, oil and water repel each other. Hence why fat tends to float, because there's a lot more fat in the undigested stool, which causes it to float. So you really got to work on the digestive support, and there could be some food allergens in regards to those fats. Okay, Sam writes in, can gut issues cause what seems like a central nervous system issue? After 2 rounds of metronidazole or flagyl in 4 months, I'm still getting severe muscle fatigue among other symptoms. It's possible. The question is, did you address all of the underlying gut issues? Were the adrenal issues addressed as well? Remember, the adrenals are kind of the hormonal interplay between your hormones and your central nervous system, right? The adrenals produce adrenaline. They also produce cortisol, which are relatively stress hormones. And they are produced by stimulation of the sympathetic nervous system. So the more your central nervous system and your activates your SNS or your sympathetic or fight or flight nervous system response, the more your adrenals are going to be kind of revved up, so to speak. So we have to make sure the adrenal issues are under control by getting the nervous system under control as well. So you may need to really look at the adrenal issues next. Nicole writes in, can you take enzymes and HCl while breastfeeding? Will it help with the baby's gas? Will it help prevent breastfed babies that have gas? Yeah, you can do HCl and enzymes while you're breastfeeding. That's very safe. And yeah, it could potentially help your baby's gas, because if you're not digesting things properly all the way, there may be some of that that's passed to the baby. Also, make sure your diet's good as well. If you're eating things that could be grain or non-paleo-esque, there could be some inflammatory things go into the baby. So keep a food log. If you notice any rashes or issues, the first thing I would look at is the ultra-rich, high sulfury foods and or FODMAPs, onions, garlic, broccoli, Brussels sprouts. Look at those things first. They're really healthy, but we may have to adjust them if we're noticing excessive gas. Barbara Scott writes in, hey, Barb, hope you're doing well. Where did it go? I've been prescribed trimethicillin and acinetide for eczema in my ears. Is this a problem holistically? I mean, it depends. We got to get to the root cause of why the eczema is there. There are other things that are more natural and herbal that tend to do pretty well. So that may be a better option in the long run. Topical antibiotics or topical things, I don't have as much of a problem with it, because it's at least hitting that area directly versus taking it orally and going through your body systemically. I don't like that. That's like trying to hit a bullseye by throwing a hand grenade, right? Not quite the specific approach. I'd rather do an herbal specific compound on the eczema. There are some things online that work really well. Perea has one called the Mother of All Creams that I like, and you can find it at justinhealth.com/shop. Click on the recommended products link. Okay. Korvac writes in, can I take cayenne for better digestion? Cayenne's very high in vitamin A. And yeah, it could be a good digestive stimulator. I mean, I like ginger as well, or bitters. Those are all great as well. Oliver writes in, I feel like I need to crack my neck often. Is it bad to do so? No pain, really, but just feel it needs cracking. Well, I think getting that neck mobilized or adjusted can be helpful. I mean, I do recommend seeing a chiropractor to do it. It's typically what happens is you have like three joints. You have joint 1, 2, 3, and joint 1 and 3 tend to be the joint that's hypomobile. So you end up cracking joint 1 and 3 and not the middle one. And that tends to be common if you're like adjusting your neck like this or like that. It's really hard because a chiropractor comes in and specifically contacts that joint versus a gross manipulation. So you really want to see a good chiropractor to do it, but I don't see it being a big deal. Jessica Lynn writes, hello, Merry Christmas. Merry Christmas to you, Jessica. Delty writes in, is there a functional medicine protocol for male pattern baldness? Well, number one, not like straight up baldness, but because there's a lot of different causes to baldness. That's the problem. When there's only one cause, there's one solution, right? You just, whatever that thing is, that you correct that mechanism, it gets better. The problem is it could be low testosterone and high DHT. And that's where things like saw palmetto or, Rogaine minoxidil, those kind of things tend to help. You can do natural 5-alpha reductase inhibitors such as selenium, lycopene, saw palmetto, pumpkin seed. You also have to make sure you're digesting proteins well. So high quality collagen, make sure you have enough HCl and enzymes in your system so you can break down proteins and fats well. Adding extra collagen, make sure there's no infections. Make sure stress hormones aren't out of control and catabolizing tissue. So got to get to the root underlying issue. Gabe writes in, what's for tomorrow's meal plan? Any cheat snacks, cheat drinks? Well, so a couple things. I have some Zivia sweetened ginger beer. So I may have a couple of Moscow mules. And I typically will use kombucha ginger with the replacement for the ginger beer. And I'll do a little Tito's vodka. I'm getting this reoccurring cold that keeps on happening. I think it's my son who's bringing stuff home. So not bad. It's just, you can just hear it in my sinuses. My energy's good. My mood's pretty good. So just that little sinus stuff, but I got some Neomed and some Exlear sinus flushing. So I'm trying to get the sinuses cleaned out. And then outside of that, we got some gluten-free desserts. I got my apple cake recipe. If you go to the members area, I have it up there, apple cake. And then everything's going to be grain-free and gluten-free. I try to use some of the grain-free flour as substitute options. See here, Jessica writes in, if I took a Genova urine heavy metals test and they came back clean, would chelation and a retest make sense to do? My doctor thinks I would, but I don't see the point. It depends, Jessica. So first off, I'd want to make sure that that test was done provoked, meaning you challenged it with some DMPS or DMSA. So we're getting an actual window into your tissue burden of heavy metals. If you didn't do that, you may be all stored in the tissue when you're not getting a window into what's happening outside of the tissue. Moon Goddess writes in, Dr. J, my doc just called and said my TSH is 0.09. I've been feeling anxious and can't sleep. She wants to put me on methimazole. Doesn't that shut down the entire thyroid? I don't like that. Yeah, it really blocks iodine absorption. That's the wrong move. You actually have to look at your T4 and your T3 levels, and you should also look at reverse T3 and your thyroid antibodies. It could be possible you had a little autoimmune flare and you dumped a whole bunch of thyroid hormone, and that's why you're feeling more anxious. It could be just some adrenal dysregulation that's causing hypothalamus, pituitary, thyroid imbalances. It could be that. So you really have to look at the full pattern. I definitely do not recommend just jumping on board and recommending methimazole just because TSH is low. That's irresponsible. You have to look at TSI, thyroid stimulating immunoglobulin. You have to look at TSH receptor site antibodies. Those are the antibodies and the stimulating immunoglobulins that cause Graves to begin with, and then actually look at the active hormones to begin with. This is just, absolute silliness that most conventional medical doctors do. They are not looking downstream enough, and a lot of times the insurance just gives them a hard time, so they're kind of handcuffed. May not be their fault, but that's why you got to see a functional medicine doc that's not handcuffed. K Gupta writes in, can you recommend a good brand of digestive bitters? Yeah, there's a couple. Chris Shade has one that's liposomal. Wise Women Herbals. Gaia has some. you can email me as well. We have some as well that work really well. Kitty Johnson writes in, iron okay, but ferritin low, also non-existent testosterone. Is it related to women 30 years old? So if ferritin's really low, I'm thinking potentially estrogen dominance. I'm thinking excessive menstruation. So I'd really work on the female hormones. I'd work on the digestion, HCl, enzymes, and I would probably give a lot of extra liver in there and some chelated iron as well. But you got to fix the underlying cause of why it's low. If you're vegan, if you're vegetarian, that's a cause. If you have low stomach acid or enzymes, that's a cause. If there's an infection that's affecting absorption, that's a cause. If there's female hormone imbalances, low progesterone, high estrogen, that's a cause. Got to get to the root issue. All right, I'm going to switch over to Facebook here. And just so you guys know, I tend to give my YouTubers more love because I got it on my 30-inch screen. It's easier to read than my 4-inch iPhone 8. What are your thoughts on nuts and seeds being anti-nutrients? And should someone with leaky gut avoid them? It depends. I typically recommend patients off the bat do an autoimmune template for a month or so, but for at least 4 weeks, and then wait till they flatline, meaning they're no longer seeing any major benefits from the diet, and then we do a very methodical reintroduction. So if we've done that and we can tolerate it, then it's probably okay. And then we may want to look at doing a reintroduction. If there's sensitivities, then we'll look at more enzymes, more HCl, and potentially soaking those foods to avoid a lot of the anti-nutrients. Great question, though. All right, can't pronounce this name. Hey, doc, what will help curbing encephalitis and brain limb swelling? Well, I mean, first thing is get the inflammation out of your body via food. Support the lymph with ginger and or burdock root. That can be helpful. Make sure you're drinking enough water. Make sure there's no inflammatory alcohol or foods or gluten, any of that junk in there. That'd be the first thing. And the next would be looking deeper at the gut at other underlying issues. Jack JMC writes in, I notice I don't sweat as much, and I used to ever since doing the herbal killing, and my stomach always feel tense. Why is that? I don't know why. I don't sweat as much. Hard to say. I mean, I would make sure you're soothing the gut. You really work on healing things and soothing things for the gut, ginger, bone broth, those kind of things, making sure you're really dialing in the probiotics. Make sure all those things are really in place and that you're digesting your food. Again, it is wintertime, so I'm not sure if that's a factor. I would need a lot more info, though. Gabe DL writes in, a family member of mine has a history of heavy acne. Doctor claims it's hormonal and are prescribing birth control pills. Any ideas why? So yeah, birth control pills off-label can be used to help with skin. Basically, it's like, if you have estrogen that's kind of petering up and down, a birth control pill kind of gives you a higher amount and it just gives it a really high amount. It gives so much that it kind of lowers the FSH and the LH. So your brain stops telling your hormones to make, your brain stops telling your ovaries to make hormones, and it just relies on the birth control pill being higher. So it just kind of gives you a set higher amount, which then, affects the fluctuation. So those fluctuations tend to be gone, which helps, but sometimes it can be worse. My suggestion is just get to the underlying reason why. Also, it does not address any of the gut issues because a lot of gut issues and inflammation issues can be at the root cause as well. So you have to get to the root cause of what's going on. Okay, here. Moon Goddess writes in, thank you so much. I appreciate it. Need to call your office. Excellent. You can email us too, office@justinhealth.com. Okay, is curcumin safe while breastfeeding? Yeah, it should be safe. It's actually a galactagogue, so it can actually improve your breast milk. I don't have a problem with it. I mean, it's common in a lot of Indian spices and Indian foods. I don't have a problem with it. Jack JMC, why is rice and beans bad to eat when lots of cultures eat it? Well, I mean, lots of cultures eat it and they soak it and they ferment it and they decrease a lot of the anti-nutrients so they're able to better tolerate it. And certain cultures have evolved to it more than others, right? So certain cultures can do it because they've had, generations of eating it. But again, a lot of it's the preparation, and many people aren't willing to do the preparation, and that's why they have problems. Many tribes and cultures knew, like, if you didn't soak your kidney beans, you'd be sick. So there was like a 24 to 48 hour preparation involved in making that happen. Robert writes in, Merry Christmas to you and yours. Thanks for all your help. You're welcome, Robert. Great chatting with you the other day, and I'm glad that you are on the right track with your healing. Great. Well, any other questions, guys? Feel free and let me know. If not, I'm going to go start my Christmas Eve festivities. I have a nice meal in the Pyrex in the oven cooking, some chicken, that was baked with some kale salad. My wife made a homemade dressing for it as well. So that's all lemon and olive oil based. So I'm excited for that. Any questions? Let me know, guys. I'm just checking over here on Facebook. See how we're looking. Okay, okay. All right, everyone. Good chatting with you. Oh, hold on. One more question here. Thanks, all. Appreciate it. Well, Merry Christmas. I'll be back this Friday very soon. I wish you guys the best. Merry Christmas. Happy holidays. And we'll talk soon. Stay healthy. Bye now.